dear friends. Welcome again to my session on preparation of UPSC Combined Medical Services. This is actually part 2, and here we will be discussing more or less of paper 1 and paper 2 both combined. So let us quickly discuss about some questions. Now I am talking about question which has been asked in the CMS paper 2. It is yet a simple question, but it is yet a tricky one. Now, which one of the following antihypertensive drug is contraindicated in pregnancy? Now, there are 4 options given: alpha methyl dopa, hydralazine, clonidine, and enalapril. Now, this is a very tricky. The answer of this is you must be all knowing, or you must know, enalapril is severely contraindicated in the case of pregnancy. Though the reason for is that we should avoid certain antihypertensive, certain drugs which to give in the pregnancy period. Now, in the diuretics are also considered as a contraindication, because by reducing the blood volume, they can increase the uteroplacental perfusion and deficitotoxemia, and there can be the increased risk of fetal wastage and placental infarct, miscarriage, etc. Unless and until it is required, because sometimes diuretics sometimes may be required also in pregnancy. So at that time, at the pathological time, it can be used, but rarely it is considered as a contraindication. Now, propranolol, that is a non-selective beta blocker, that is also contraindicated because it is said to be considered as a low birth weight. Decrease, it is placental size, neonatal bradycardia also, and it also causes hypoglycemia. Sodium nitroprusside also, which we also give for in cardiac anomaly, it is also contraindicated, and it is contraindicated in the eclampsia also, and as well as in the pregnancy. Now, Respirin, it causes suicidal tendency in mother, causes the nasal obstruction, DNS respiratory and temperature control in newborn. And like ACE inhibitor, which I already discussed, like enalapril and captopril, should be avoided in pregnancy as they cause fetal fetal oligohydramnios, IUGR, fetal or neonatal renal failure. So all these things are antihypertensive. All drugs are contraindicated in the pregnancy. Now, some drugs which we can give, which we can give easily are like methyl dopa we can give, hydralazine, clonidine we can give. They are safe. Labetalol is also a drug which can be given in the preeclampsia period. Now, so these are some of the question which I have some of the question. Now I will be coming to another question in the paper 2 only. Now I will be discussing in paper 2 also only now. After that I will be coming to paper 1. Now it is also a very important question which is frequently asked in the this UPSC examination, UPSC Combined Medical Services. That is, consider the following statement with regard to the MTP Act. MTP can be performed by a doctor who has performed at least 25 MTP under supervision and independently. And place for MTP must be approved by government, and facility for doing emergency laparotomy should be available. Now, which of the following statements are correct? So here the 3 statements are given. So if you critically see, the 3 statements are correct. So statement number 1, MTP can be performed by a doctor who has performed at least 25 MTP under supervision and independently. That is also a correct statement. And secondly, place for MTP must be approved by the government. That is also a correct statement, because as per MTP Act 1971 and as well as the Amendment Act 2021, it should be approved by the government. And third is the facility for doing emergency laparotomy should be available, and that is also one of the essential feature of MTP. So 1, 2, and 3, these three statements are correct. Now I will be discussing one question from again one of EA only, paper 2 only. Now now this question is also very important. As per the Central Birth and Registration Act, which is acted in 1916, which is in 1969, an event of death is required to be registered in how many days? There is 3 days, 7 days, 10 days, and 14 days. So the correct answer for it is 7 days, because the Central Birth and Registration Act 19 came into force on 1st April 1970, and the time limit for registering the event of birth is 14 days. For the birth it is 14 days and death is 7 days. In case of default, the fine is up to 50 rupees. And there is a Census Act also, which was enacted in 1948. The legal basis of census is provided. The last census it was held in March 2001. Again, it was the first regular census in India was taken in 1881, and thereafter 10 years interval. And these are some of the information which I thought to share. Sample registration system is also a system which is done by the government. In 1960, it was started to provide the estimate of birth and death rate. That is a dual system consisting of continuous enumeration of independent survey every 6 months. So it is also important point which can be asked. Census Act can be generally it is not asked. It is the Central Birth and Registration Act question is always asked, that event of death or event of birth, registration, etc. Now again I am discussing one important regarding all are important, but still this all question I am taking help, as I told you earlier, I am taking the help of Prasad Comprehensive Guide to UPSC CMS by written by Professor Dr. Rajiv Kumar. So I am taking the help of that book only, because the explanation is clearly given and taken from the standard textbooks. Like in medicine, the reference has been taken from Harrison, from pathology, Robbins, etc. From the PSM part, from gynecology, like Williams, Shaw, or Novak's, etc. So now another important, one of the most important question in paper 2, which should be discussed. Now it is one of the important questions that I should discuss. Now consider here is a statement wide question. A 16-year-old child statement number 1, makes polysyllable vowel sounds. Secondly, get excited at the sight of food. Third is enjoys mirror, and 4 is laughs out loud. So which is the statement given below, is or are correct? So you have to tell that which statement is or which statements are correct. So here if we see critically, the 16-week-old child, statement numbers 2, which is get excited at the sight of food, and 4, laughs out loud, that is the correct statement, because at the 4-month-old infant described as hatching and socially becoming interested in a wider world, and during feeding, infants no longer focus exclusively on the mother but become distracted. In mother's arm, the infant may literally turn around, preferring the face outward. Now by the 3 months, it often vocalizes with 2 or more different syllables. By 6 months, occasionally vocalize 4 or more different syllables at one time. So, and by the end of 9 month, intonated blabble with sequence of sound, blabble more complete with different vowel and consonants. So, 16 week, the statement 2 is very correct, which is get excited at the sight of food, and secondly, laughs out loud. That is also a correct statement. But makes polysyllable vowel sound, it is not correct, and enjoys mirror, that is also not correct, because that is done after some period. Now, this is also a very important question. Now, I am again coming to on paper 2 only. Now, now this is a very not important question, but it is a very common question which is always asked in the CMS exam. In paper 2, a 2-year-old healthy child suddenly develops breathlessness while playing, otherwise normal. The baby is normal, the healthy child is normal, and suddenly the child becomes breathless while playing. And what is the most likely cause? So the options are status asthmaticus, and B is pneumothorax, C is foreign body aspiration, or D is the cardiac failure. So the most common of a 2 year of healthy child developing breathlessness is the foreign body aspiration, because young children between 1 to 4 years age are especially, they are very prone to aspirate. The typical history of sudden paroxysm of violent cough, hoarseness, dyspnea, or cyanosis, and the symptoms of the characteristic signs are wheeze and audible, slap, and palpable. There is a third, which is produced by the monometric expiratory impaction at the subglottic level. In 80%, there will be history of wheezing. On chest radiograph, most often hyperinflammation on the side of the foreign body, and about 60% on the right side. So, as per this Ghai and Nelson also, right and left main bronchial foreign body aspiration occur with roughly equal frequency in children. So the foreign body aspiration is most frequent in the case of 2-year-old healthy child, which is developing breathlessness while playing. Status is very rare here, unless and until the boy is having some pathology. Pneumothorax is also very rare, and cardiac failure, unless and until the history is given, so it will be termed as rare only in this particular question. So these are some of the questions. Now, one of the most important question which stuck in my mind is most important significant test to find out the strength of association. This is very important question. The most important significant test to find out the strength of association between variables is, first is standard error of difference of mean, then B is regression coefficient test, C is t-test, which is also known as student test, and fourth is chi-square test. So the most significant test to find out the strength of association between variables is the chi-square test, because chi-square test is applied to find the association between two events occurring together when there are two or more classes, or two or more classes, or more than two samples. Now, appropriate when both predictor and outcome variables are dichotomous, and as compared to the prevalence of, like prevalence of HBsAg in medical and dental student is classified the presence and absence of antigen, and by medical or dental student status. So this is the most important significant test to find out the strength of association between variables. So the chi-square test is a preferred important significant test rather than standard error of difference of mean or regression or student test. So this is one of the very important question which you must remember, why a chi-square test is important, and why other standard error of difference of mean or regression or t-test is not so important. As important is chi-square test. When The strength significant test is to find out the strength of association between the variables. So now these are the some of the question. Now one more last question I want to discuss, because today I am discussing more of some PSM questions, very easy PSM questions. Now the specificity of a screening test is its ability to correctly identify the high proportion of true positive, true negative, false negative. Specificity is mean the person who have the disease or do not have the disease. Specificity means the person who actually do not have the disease. So here it will be, the answer will be true positive, true negative, false negative. The answer will be true negative. So true negative, that means negative which is true. So this it is the specificity. So now I will be coming again with the some discussion with again with some of the, now in today's question answer discussion I have only discussed about in about paper 2 only. I have not discussed paper 1. Paper 1 I will discuss in again in when I will make my video, and please subscribe my channel for daily updates. And as we all know that I have already told you when the exam is going to take place in for UPSC CMS, and so start preparing. And again, if I am telling, if you have any query or if you have any question to ask in any of the paper 1 or paper 2, you can ask me in my Telegram group, or you can ask in the YouTube channel also in comment section. So or any question you have not understood, or you want explanation, so you can ask me separately also for that. And so it is between 2 or 3 days I will be coming again, and I will be discussing with you some more questions on paper 1, paper 2 together, and we will be solving some of the questions, some of the numericals also, because in PSM numericals are also asked, simple numericals are there. So I will be discussing with you that also. Till then, you take care and prepare well for your UPSC forthcoming examination.